If you are 75 or older and you stretch every morning yet still feel unsteady when you first stand up, this is probably why. Stretching lengthens tissue, but it does not switch your muscles. Specialist in orthopedic with more than 30 years in operating rooms and rehab wards, see repeatedly is that passive flexibility helps range of motion. But without targeted activation, before you put weight through your legs, balance and circulation remain vulnerable. Tell me your age and country in the comments so I can understand who I'm talking to. If you want more evidence-based mobility tips, hit like and subscribe. Let me be clear about the central idea. Stretching and activation are not the same. Stretching reduces stiffness by lengthening tendons and muscle fibers, which can feel good and maintain joint range. Activation primes the muscle to contract efficiently, restoring blood flow, warming tissue, and re-engaging the nervous system so the muscle responds quickly when you stand, step, or turn. After roughly age 75, many people experience both loss of muscle mass and a delay in how quickly muscles respond to a balance threat. The result is that a well-stretched leg that is soft can still fail to protect you if the muscle that should stop a stumble never turns on fast enough. There are two practical consequences everyone needs to understand. First, the calf and foot pump play an outsized role in returning blood from the legs and in stabilizing the ankle during the first steps of the day. Second, the quadriceps and hip gluteal muscles act as gatekeepers for standing, stepping, and climbing. If they are weak or slow, walking speed drops and fall risk rises. Studies summarized in journals such as the Journal of Gerontology and JAMA have linked lower limb strength and activation speed to walking speed and fall incidence in older adults. We translate that into action here, not promises. Only consistent practice has been shown to improve these measures in many older adults, though individual results vary. I'm going to lead you through 5 bed-based activation exercises ranked from least to most impactful for someone over 75. Each exercise includes the why, how-to cues with exact tempo and repetitions, safety notes, common mistakes and corrections, progressions for frail beginners, and advanced options if you are ready. These are meant to be done without special equipment and organized into a short morning routine you can finish in under 15 minutes. We begin with the simplest but essential: ankle pumps and circles. The calf is a secondary pump for circulation and the first-line stabilizer for the ankle. When you do ankle pumps, you wake up the calf muscle so that it can both push blood back toward the heart and provide a quick stiffening response under the foot. Lie on your back with your legs long and relaxed. Point your toes away from you over 2 seconds, hold 1 second, then slowly pull your toes back toward your head over 2 seconds. Hold 1 second and repeat. That tempo, 2 seconds movement, 1 second hold, keeps the motion controlled and allows venous return. Aim for 10 to 20 repetitions per leg, 1 to 2 sets, resting 30 seconds between sets. If 10 feels like too much at first, start with 5 and add 1 or 2 reps each day until you reach 10 to 20. A common mistake is moving too quickly or shrugging the knee. Keep the motion isolated at the ankle and maintain relaxed hips. Another error is bouncing. Avoid quick, uncontrolled thrusts. If you have very stiff ankles, reduce range of motion and focus on a smooth rhythm first. For frailer individuals, perform ankle pumps while seated or with the feet flat on the bed, sliding the toes toward and away from the shin without forcing the range. For more challenge, add ankle circles after a set of pumps. Rotate the foot clockwise for 10 controlled rotations over 4 to 6 seconds, then counterclockwise the same way. Circles engage different muscle fibers around the ankle and improve proprioception, the sense of where your foot is in space, before you stand. Safety note: if you notice sudden new calf swelling, acute pain, redness, or warmth, or if you have a history of deep vein thrombosis, DVT, stop and seek medical evaluation. These can be signs of a clot and require urgent attention. Otherwise, Mild muscle soreness over the next day is normal as the calf begins to reawaken. Next, heel slides. The knee is sensitive to morning stiffness and needs gentle movement to restore synovial fluid distribution and maintain the sliding surfaces in the joint. Heel slides mobilize the knee and gently engage the quadriceps and hamstrings without weight-bearing stress. Lie on your back with both legs straight. Bend one knee by sliding the heel toward your buttock over 2 seconds. Keep the foot in contact with the bed. Pause 1 second when the knee is comfortably bent. Then slowly slide the heel back down straight over 2 seconds. Repeat 10 to 15 times per leg for 1 to 2 sets, resting 30-60 seconds between sets. A typical mistake is lifting the heel off the bed instead of sliding, which reduces joint gliding. Keep the heel in contact with the surface and think of the kneecap moving straight up toward the ceiling as the thigh engages. If you feel a sharp pain anywhere in the knee, stop. For very stiff knees or recent knee surgery where range is still guarded, reduce range to a pain-free arc. Slide to the point where you feel a gentle stretch and back. Then slowly increase range over weeks. For a progression, add a short isometric hold when the knee is bent. At the top of the slide, press the heel lightly into the bed and hold for 5 seconds before returning. That isometric cue builds quadriceps engagement without full extension under load. Third is supine marching. This exercise teaches timing between the hip flexors and the core and trains the nervous system to lift the thigh quickly and safely, a movement needed to clear the foot during gait and to prevent shuffling. Lie on your back with knees bent about 90 degrees and feet flat on the bed. Engage your lower belly gently to stabilize the pelvis. Lift one foot an inch or two off the bed, bringing the knee toward your chest over 1 second. Hold 1 second, and slowly lower it back over 2 seconds. Alternate legs in a marching rhythm. 1 second lift, 1 second hold, 2 second lower. Start with 6 to 10 marches per leg, 1 to 2 sets, resting 30 to 60 seconds between sets. Common faults include arching the lower back, which indicates the core isn't stabilizing. Correct this by gently tucking the pelvis and imagining a small flattening of the lower back onto the bed. Another mistake is driving the knee up using momentum. Focus on a slow, controlled lift. For frail beginners, lift just an inch with a longer hold to build neural control without challenging strength. For progression, increase the hold time to 2 or 3 seconds at the top, or add a small weight at the ankle only if cleared by a clinician and if your form remains perfect. Clinically, improved hip flexor activation reduces the tendency to shuffle and shortens the time the foot spends on the ground. Both factors linked with safer walking. Number 4 is the straight leg raise, a deceptively powerful exercise focused on the quadriceps. Quadriceps strength declines roughly about 3 to 5% per year after age 70 in many people, and it's the quads that control knee extension and stabilize you when standing from a chair or stepping down. The straight leg raise isolates the quadriceps and the ability to control knee extension without requiring you to stand. Lie on your back, one knee bent with foot flat for support, the other leg straight. Tighten the quadriceps on the straight leg so the kneecap points up, then slowly raise the straight leg to about 30 to 45 degrees over 2 seconds. Hold for 2 seconds, and lower over 3 seconds. Do 8 to 12 repetitions for 1 to 3 sets, resting 60 seconds between sets. A very common error is letting the opposite hip lift off the bed or bending the knee unconsciously. Keep the hips level and the opposite knee relaxed. If you feel pain behind the knee or in the lower back, back off the range and reassess your pelvic alignment. For frailer individuals, perform the movement with a bent support knee as taught. Start with 5 repetitions and focus on the slow lowering phase to train eccentric control. Raise 2 seconds, hold 1, lower 3 seconds. To progress, add ankle weights very gradually, or move to a straight leg raise with a small pillow under the knee to vary the muscle length. The straight leg raise trains both the strength and the eccentric control that protects the knee when you descend stairs or step down, skills that preserve independence. Now we arrive at the single most impactful bed exercise for most older adults, the glute bridge. The gluteal muscles are central to standing, walking, climbing, and resisting forward falls. In many older adults, the glutes become underused, what I call gluteal amnesia, because sitting dominates daily life. The bridge wakes the posterior chain, lengthens the hip flexors, and trains a coordinated firing pattern that protects the lower back and enables a stronger step. Lie on your back with knees bent and feet flat, hip-width apart. Press through the heels and lift your hips until the body forms a straight line from shoulders to knees over 2 seconds. Squeeze the glutes at the top for 2 to 3 seconds, then lower slowly over 3 seconds. Perform 8 to 15 repetitions for 1 to 3 sets, resting 60 to 90 seconds between sets. Common mistakes include pushing through the toes rather than the heels. This reduces glute activation and increases hamstring dominance, and overextending the lower back at the top. Keep the ribs down, maintain a neutral pelvis, and imagine lifting from the top of the thighs. For those with knee discomfort, reduce the range of motion and hold a gentle bridge for shorter times. For frail starters, begin with pelvic tilts rather than full bridges. Lie flat, rock the pelvis to flatten the back, and then release. Progressions include single leg bridges when strength is sufficient, or adding a small cushion beneath the sacrum for a supported bridge if hip extension is limited. Clinically, stronger glutes translate to improved ability to rise from a chair, climb stairs, and maintain upright posture, functions closely tied to independence. Throughout these exercises, tempo matters. I've recommended explicit timings, lifts and movements over 1 to 2 seconds, holds of 1 to 3 seconds, and slow lowering phases of 2 to 3 seconds. Why slow lowering? Because eccentric control, the ability to control the muscle as it lengthens, is often where function is lost and where falls happen. Controlled tempo trains both strength and coordination. Now let me paint a full morning routine that puts these 5 exercises together into an under 15-minute sequence you can do in bed before you stand. Start with a brief breathing and awareness check for 30 seconds. Take calm breaths and notice any joint pain or swelling. If anything feels acutely different than your usual, pause and call your clinician. Then perform 2 sets of ankle pumps, circles for both ankles, about 2 minutes total. Move to 2 sets of heel slides, 1 minute per leg, 2 to 3 minutes. Next, do supine marching for 2 sets, about 2 to 3 minutes. Then perform straight leg raises for 2 sets, about 3 to 4 minutes including rests. Finish with glute bridges, 2 to 3 sets, taking about 4 to 5 minutes. Allow short rests between sets and aim to keep the entire flow under 15 minutes. Over time you can increase from 2 sets to 3 sets, add repetitions, or lengthen holds. Visual timers on the screen or an on-screen checklist help you maintain tempo and progression. If you are frail or recently more sedentary, reduce every dosage by half. Fewer reps, longer rests, smaller range of motion. Consistency matters more than daily intensity. Start small and build. For many older adults, practicing this routine 5 to 7 days a week for several weeks produces measurable improvements in walking speed and reduced morning stiffness. Remember, I am describing likely trends based on clinical experience and published studies. Individual responses vary. Let me highlight specific form cues that are essential when you or a caregiver demonstrate these moves on screen. For ankle pumps, show close-ups of the foot. The heel should stay steady during dorsiflexion, and the toes should not curl. For heel slides, demonstrate the heel staying in contact with the bed to ensure joint glide. For supine marching, show a side-on view so people can see the degree of knee lift and the neutral pelvis. For straight leg raises, demonstrate the opposite knee bent and the kneecap pointing straight up. Use a split screen to show the mistake of letting the hip twist. For bridges, show heel placement under the knees, heels pressing down through the bed, and a squeeze at the top rather than an arch in the low back. There are a few red flags and safety checkpoints to emphasize. Stop any activity immediately if you experience sharp or severe joint pain, sudden swelling in a limb, chest pain, sudden breathlessness, or lightheadedness. New or worsening calf pain with redness and swelling could be a DVT and deserves urgent medical assessment. If you have an unstable cardiac condition, a recent cardiac event, uncontrolled hypertension, recent major surgery, or an active DVT, please consult your healthcare provider before starting this or any exercise program. Do not push through severe pain. Scaling down and seeking professional guidance is the right approach. Let me also address blood pressure and dizziness. Many older adults experience orthostatic hypotension, a drop in blood pressure when standing quickly. Performing these bed-based activations gently while still lying down and then sitting at the bedside for a moment before standing can reduce dizziness. Stand slowly, take a few breaths, and check for balance before taking a step. If you regularly feel faint when standing, consult your primary care provider. Progression guidance is straightforward and conservative. Weeks 1 to 4. Focus on consistent practice with reduced dosages. 5-8 repetitions per exercise, 1 to 2 sets, slower tempo. Weeks 5 to 8. Increase to target dosages listed earlier. 8 to 15 repetitions, 2 to 3 sets, and longer holds. Week 9 onward, add more functional challenges such as standing mini squats, step-ups, or single leg balance with supervision as tolerated. If adding load, do so very gradually, and only when form is solid. For caregivers, assist in counting reps, watching for breath holding, and encouraging rest when needed. Now, a quick review of why each exercise matters in functional terms. Ankle pumps and circles restore calf pump and ankle responsiveness, helping circulation and quick ankle stabilization. Heel slides maintain knee glide and a pain-free range so you can bend and step more easily. Supine marching trains, hip flexors, and core timing to prevent shuffling. Straight leg raises rebuild quadriceps, strength essential for rising and stepping. Glute bridges reactivate the posterior chain that powers safe standing and effective gait. Together they address circulation, joint mobility, strength, and neural timing, the 4 pillars I see repeatedly in patients who regain safer mobility. You may be wondering how these exercises compare with classical stretching. Stretching remains valuable to maintain and restore range, particularly where contractures or high tone are present. But if your priority is safer walking, quicker reactions, and independence in daily tasks, activation plus progressive strengthening and task-specific practice are what the evidence and decades of clinical observation recommend. Think of stretching as loosening the door. Activation is switching the light on and turning the knob. A final practical tip. Make this routine predictable. Perform it at about the same time each morning. Pair it with a routine cue, while the kettle warms, in bed before you reach for the phone, or immediately after toileting. Use a small log or calendar to track completion rather than performance. Consistency beats intensity when you are building a habit. I need to repeat the safety line plainly. Consult a healthcare professional before beginning this or any exercise program if you have major medical conditions, recent surgery, or known vascular or cardiac issues. And again, stop for sharp pain, sudden swelling, chest pain, or severe shortness of breath and seek immediate care. In closing, stretching plays a role in a mobility program. But if you are 75 or older and find that stretching alone hasn't kept you steady, what you likely need is activation, retraining the muscles to respond quickly, restoring the calf pump, waking the hip flexors, rebuilding the quadriceps, and re-engaging the glutes. These bed-based activation exercises are designed to do exactly that in under 15 minutes, with progressions for frail beginners and advanced options for those ready to push further. Small daily actions add up to big changes in walking speed, confidence, and independence over time. If you found this helpful, subscribe for more grounded mobility. Tell me your age and country in the comments. I read them and tailor future content to the people watching. Share this with a friend or family member who gets up stiff in the morning. They may be surprised how much a 5-minute activation habit can change their day. Important notice: this content is for educational and informational purposes only and is not intended to replace medical advice. Always consult a qualified healthcare professional or physician before making changes to your diet, supplements, or health routine.